Boy, this is a rough crowd. Everybody gets a teleprompter. I get paper and bifocals, okay? I am deeply grateful for this recognition with the Sister Carol Keehan Award. The work has never been mine alone. It has always depended on the love and support of family, friends, colleagues, and the steady companionship of my four-legged guardian angels. I hope this recognition, though, is not revoked after the next 2 minutes. I know my clinical work is not what most people think of when they picture Catholic healthcare, especially Catholic healthcare today: addiction medicine, correctional healthcare, and community health. I am extremely grateful that SSM Health and a few other systems, such as Trinity Health out of Michigan, has some addiction medicine programming up there, okay? I am grateful that these folks have stepped into this space, but across Catholic healthcare, these are still generally missed opportunities for ministry and, yes, even for revenue diversification. This is good contract work, folks. Right now, life can seem particularly grinding, both on campus and off campus. We are stunned when we learn that community members have been rounded up and detained in a facility with little food and no medical care. We are outraged when we hear about a woman in an Alabama jail who was forced to give birth unassisted in the infirmary shower and then almost died from a placental abruption. And our hearts break a little when we speak to a neighbor whose son died from an overdose less than a week after he was discharged from the local ED with just a few doses of Narcan and a referral to state-funded treatment program with a 4-week waiting list. These are my people. But they're also individuals that are among our most vulnerable and overlooked. And sadly, we have largely handed over our ethical responsibility to provide medical services for these individuals and families to for-profit, investor-owned, publicly traded companies. A few of my comments got cut from the video. You probably see why. That's why I'm happy to have my 3 minutes. So, United for Change. I imagine most of us are united in believing that thoughts and prayers are good, but change in behavior is better. We need to continue to find new ways to step off of our manicured campuses, partner with communities, and deliver care that is messy, less predictable, but deeply gratifying and transformative for our patients and for ourselves. We also have a proud history of messy and unpredictable in the church. Think of St. Basil and the care of those in 4th century Caesarea with leprosy, often considered the first hospital. Think of the medieval hospitals connected to cathedrals and abbeys. And perhaps most importantly, and the reason we're here tonight, think of the countless women religious who founded our hospitals throughout the United States. Messy and unpredictable was the leaven in their bread. It was not the icing on their cake that could get scraped off and set aside when budgets get tight, when funding changes, and when political climates change. CHA has roots in St. Louis University, so I will finish with an adaptation of a Jesuit charism. Catholic healthcare must set the healthcare world on fire. If we are to remain relevant, and to thrive in this century, we must be bolder in how we define our mission, in how we reach people and new communities, in the services we offer, and in how our budgets and strategies reflect our values. That's a shout out to Sister Jean DeBlois, who was my mentor in Aquinas Institute of Theology. And we must be united in that change. Tonight's recognition highlights a few sparks. My hope is that each of you leaves this assembly with at least one of them. So let's engage in some behavior change and let's set the world on fire. Thank you.